It's 11 minutes past 8. Around 3 million NHS staff could soon be getting mandatory training on how to better treat patients with learning disabilities. The government begins a consultation today on how it could work.
This follows a lengthy campaign which has been followed by us here on Breakfast. Charities and families include Paula and Tom McGowan, whose 18-year-old son Oliver died back in 2016 following an allergic reaction to drugs he'd asked not to be given.
So make sure you do it differently.
First and foremost, the most important lesson is to actually listen to the patient, to the person, and then to listen to the family around the patient, the family and carers. Listening is effective communication. You know, it's actually listening and taking on board what that person is actually saying.
We'd engaged with the processes within the NHS, like hospital passports and medical care plans. These were all in place, and yet when Oliver went into A&E, there were no what's termed the reasonable adjustments, which basically means adapting the environment, giving him a quieter space, not so rowdy. It was a Saturday night in A&E, there was lots going on. He was autistic, he had people on him, people holding him. That was effectively exacerbating the situation.
Oliver was the most generous, positive person ever. He would want us to do this. He would want us to make changes, but not just changes, effective changes.
We're joined now by Leroy Binns, who has a learning disability and feels his treatment in the NHS hospital could have been much better, and also by Dan Scorer, who's from charity MenCat, supports people with learning disabilities. Thank you to a pair of you for coming on this morning. Leroy, can we start with you? Tell us a little bit about the sort of treatment you had and how you feel that could have been improved.
In 2012, I went to Cardiology Hospital at University College, and the doctor there said to me that I had a mild heart attack. It wasn't until 2014 when I went back to a doctor, he told me that, a different doctor, and I said, but how? Because I wasn't told. He said, you were. And then he showed me a letter which the doctor said, and it was in what you call medical jargon, which you or I would not understand.
Do you think if you'd known that you'd have a heart attack, that would have helped you at the time?
Yes, because I could have done something about it.
That's so interesting. So it was the language used, was it, that was the issue?
Yes, not acceptable.
Yeah. So what sort of things do you think should be changed, Dan? Because obviously, you know, it has an impact on people, doesn't it? If they don't understand a diagnosis, for example, or maybe, I don't know, medicine that they're being given.
That's right, so Leroy's just given some really important examples. So the way that doctors communicate with people with a learning disability, do they do it in language that people can understand? The letters that are sent out, you know, most people can't understand. They use lots of medical jargon. So Leroy would be able to understand easy read, where there's simpler language and pictures in the letter. So these are kind of basic reasonable adjustments, simple changes that can be made about the way that care is delivered, which means that people with a learning disability can understand what's happening and can be equal partners in their care. And these kind of changes are absolutely vital to saving lives, because every year over 1,000 people with a learning disability die avoidably when, if they got timely access to good quality healthcare, their lives could have been saved.
Which is a shocking statistic, isn't it? I know, Leroy, you've already sort of spoken to some doctors and nurses and tried to recruit them for this Learning Disability Champions scheme.
Yes.
What did they say to you when you tried to talk to them about that? Were they open to your sort of ideas?
They were reasonable, and they were open to make changes.
Which is really important, isn't it?
Yeah.
Dan, what sort of training do you give them, and how can that help people?
So the most important thing is that they have training with people with a learning disability and families, so they have face-to-face contact, so they actually understand directly from people with a learning disability what the issues are and the changes that need to be made. They also need to understand some of the key laws they need to be working around to make sure they're making the changes for people with a learning disability, and that where people with a learning disability are not able to make decisions about their care, they're using the proper kind of law and decision making tools to make sure those people do get the care that they need.
Is it possible to have a sort of one-size-fits-all response? Because there's such a huge range of learning disabilities, aren't there?
That's right. So the training that we're hoping is going to roll out next year, that the government's talking about in the consultation they've launched today, needs to be very much tailored to people in different roles, doctors and nurses and other professionals working in hospitals, porters, receptionists. Everyone needs to have that basic awareness.
And Leroy, just quickly, what would your message be to nurses, doctors, other people in a medical environment about how they speak to you?
Use very, very accessible language.
Right.
And make very reasonable adjustments so that everyone can have a good healthcare.
So accessible language is absolutely key for you. Thank you very much. It's really good to speak to you.
And you made it very clear, Leroy.
Yeah.
Thank you very much for that. And
Thank you.
good to see you as well.
Thanks, both.